Hello, everybody, and welcome to today's webinar hosted by the Global Law Enforcement and Public Health Association. This is one of a series of webinars taking place on the subject of police and the COVID-19 epidemic. Today, we're lucky enough to hear perspectives from police officers in South Asian countries from Bangladesh, Pakistan, and Nepal. Before we get started, I'd just like to go through a few very brief housekeeping notes for today before I hand over to the moderator. This is a brief outline of the agenda for today. During the webinar, there are really three things that we need to bear in mind. One is if you could, unless you're speaking, if you could keep your microphone muted, that would be very helpful. Thank you very much. If you want to see the other participants who are taking part, you can just click on that participants button at the bottom of the screen. And we will be encouraging you to share any questions during the presentations and during the question and answer session using the chat box at the bottom. We may also invite you to ask your questions over audio, but we're hoping there'll be so many. We'll try and consolidate them and raise those through the chat box. So please feel free to put questions in the chat while the speakers are presenting. That's all from me. The director of the Global Law Enforcement and Public Health Association, Nick Crofts, is currently in Australia and has, I'm not sure he's actually with us today, but he has sent a video recording, and we're just going to play that to you before we hand over to the moderator. If you could just play that video, that'd be great. Thank you.
Hello, my name is Nick Crofts. I'm the Executive Director of the Global Law Enforcement and Public Health Association. The Global Law Enforcement and Public Health Association exists because we recognise that there are no simple solutions to complex issues, and certainly not solutions that operate through one sector, be it law enforcement, public health or otherwise. That the solutions, the approaches that are effective are made up of partnerships, looking at common goals, consensus goals to work together. We're running a series of webinars to raise interest and create awareness about the need to look at intersectoral approaches to these complex issues. This webinar is one of a series looking at the police experience of trying to deal with the complex issues that arise out of epidemics, in particular COVID-19 pandemic. It's one in a number of webinars that GLEFA is organising. This particular one is focusing on some countries in South Asia, and we'll continue to do more to get the police voice and the police experience of trying to deal with issues that they're not necessarily trained to deal with and that have many challenging aspects. So I would like to introduce our host for this webinar, Dr. Mukhtar Sharma, who works with WHO, World Health Organization in New Delhi. And Dr. Sharma will now take us into the webinar. Thank you.
Thank you very much for that very kind introduction. I hope you can all hear me well. I'm going to take a couple of minutes just to tell you a little bit about the structure of the webinar today, and then go on to introduce our speakers. The webinar focuses on South Asia, and today we have speakers from Pakistan, Bangladesh, and Nepal. This has been a region which has been very heavily hit by COVID, and for the first time we are seeing such a massive involvement of police forces in public policing, in supporting a pandemic. And the functions that the police have undertaken during these times have varied from public order, enforcement of lockdowns, to supporting funerals of people who have died and where bodies have been unclaimed. So really a massive scale of operations for the police, and very, very different functions to what the police has been used to. So what we're going to do today is try and examine what have been the experiences of the police forces in South Asia, what has been something what is the key challenge, and to really hear from the police perspective. We often hear about COVID and pandemics from the public health perspective, but to hear from the police perspective what it has meant for them to deliver on their role during the pandemic. So what we're going to be seeing in this experience is
I think you're muted without realizing, Mukhtar.
okay. So what we're going to see is that the police are a very integral and critical part of the public health workforce. And the sacrifices that have been made by the police in delivering this, when there have been challenges to their own safety, to their own capacity, have also been very notable. So let's hear a little bit today about how they have actively engaged with public health, with the goals of public health, how they have been full partners in the public health aims, in delivering on those aims. And what we will start off today is by hearing from Superintendent Suhai Aziz Talpur. Superintendent Aziz Talpur is from Pakistan. She has been recommended for the country's highest civil award, a gallantry award, which is called the Quaid-e-Azam Police Medal for Gallantry. She foiled a terrorist attack on the Chinese consulate in Karachi on 23 November 2018. She has worked her way up through the ranks, and she has been nominated as a member of a senior committee by the Provincial High Court for the Protection of Women's Rights, and has served as the first woman commanding officer on 5 posts where she has served so far, out of 7 where she has served so far. During the pandemic, Superintendent Suhai was posted as the district police officer in a rural district called Sujawal in the southern part of Sindh. Sindh is a province in Pakistan. And we would want to hear a little bit from Superintendent Suhai about her experience in supporting the public health and public security aspects during the COVID pandemic. The pandemic is not over, but the most extreme parts of the pandemic, which we saw last year in Pakistan, in India, in all of South Asia, have sort of calmed down a little bit. So I'm going to turn it over to you, Superintendent Aziz, to tell us a little bit about what you learned, what was your experience, what was your challenge, what are some of the good practices that we can take forward in public policing and public health in the partnership. So over to you, please.
Good afternoon, everyone. Thank you so much, Mukhtar, for such a delightful introduction that you gave about me to the panel here. First of all, I want to tell the participants about police organizations in Pakistan. We have 15 police organizations in Pakistan. Out of those 15, around 8 police organizations are those which directly deal with the public. And these 8 police organizations actually deal the matters related to COVID. Those 8 police organizations are Sindh Police, Punjab Police, Khyber Pakhtunkhwa Police, Balochistan Police, Islamabad Police, Gilgit-Baltistan Police, Kashmir Police, and National Highway and Motorway Police. These 8 organizations are actually on road and they deal with public during the first and second wave of COVID-19 in Pakistan. Before going further, I would like to tell the panel that 24 officers from Sindh Police, my organization, they laid their lives while serving and they contracted COVID while delivering their duties, and unfortunately, they died of COVID-19. And they have been given reward privileges after that, as they are given to those who die while fighting the terrorists or who die while fighting the criminals. So they are called the martyrs and they've been given the status of martyrs, those who died of COVID-19 while performing their duties. I was in District Sujawal during the first wave of COVID-19, On 23rd March 2020, a lockdown was imposed in the province of Sindh, and it became duty of law enforcement agencies to enforce lockdown in the cities, in the towns where they are set. My area of responsibility was district Sijawal. It's in the south part of Sindh. So the responsibilities include a check on entry and exit points of cities, along with health professionals. Each and every entry and exit point of a city was properly known by police along with health professionals. And the people who were coming inside the city, they were properly checked and they were asked about their contacts, and they were screened by health professionals about COVID-19. And those were the times when COVID was quite new for everyone, and like back then the fear was more. There was more fear than knowing about the tools to how to save someone from COVID. So police was there on entry on exit points of all the cities during the first wave of COVID-19, and they were checking everything. Back then, China, Iran, and Italy had higher number of COVID-19 cases. So the people returning from these countries were specifically screened. Many Pakistani people were in Iran. They were performing religious ritual over there, a religious site that is visited by most of the Pakistanis every year. So most of the Pakistanis were coming back from Iran. And Iran had high number of COVID-19 patients. So that's why people coming back from Iran, they were kept in quarantine centers, and those people whom they contacted were also placed in quarantine centers. These quarantine centers were also manned by police because to, uh, to, uh, to safeguard those quarantine centers, because the situation was new. No one knew that was the next thing. No one back then knew that what is now next course of action. So police was kept outside of the quarantine centers, and public police officer was there to deal with public, to deal with the relatives of the people who were coming to meet the patient. And police and health professionals were the people who were given the responsibility of counseling the people who were kept in quarantine centers. Apart from this, there was some other issues as well. Those issues include the price control and holding. Because of COVID-19, there was lockdown imposed all over the country. So this problem occurred that many people bought all the things from the market, and the few businessmen were keeping the things, they were holding the things. So it became the duty of district administration along with police department to keep a check on this thing so that people may not run out of from the necessities of life. Apart from this, along with all these responsibilities, police were also given the responsibility uh, to control the law and order, to control the conventional crime. And because of the lockdown, there was a surge in unemployment, and definitely unemployment leads to worse increase in crime. So the responsibility on police officers, along with the responsibility that suddenly occurred because of COVID-19, the responsibility of controlling the conventional crime also increased because many people lost their jobs. So government of Pakistan announced uh, cash and edibles, groceries distributed among the people. So this became again the responsibility of police along with district administration to distribute cash among the people and to distribute groceries among the people at their doorsteps, and to keep safe those godowns where these things were kept. It became the responsibility of police officers. Apart from this, another issue that surfaced was increase in domestic violence because the abuser was during the lockdown was at home all the time. So the cases of domestic violence also increased. The lady officers in our police stations, in our women protection cells, in the different units were overburdened by dealing such kind of issues. The welfare of police officers itself became a big issue because the families of police officers were at risk because police officers were dealing with masses on daily basis, and then at the end of the day they were going back to their home. So the safety of the families of police officers and the safety of police officers themselves was an issue that was dealt very intelligently by the police leadership. The things that I learned and the things that I appreciated during this COVID-19 was the care and consideration by the government of Pakistan and by the leadership of police towards the cop on the street. That was really appreciable, and that was really huge. Apart from this, I learned few more things. I learned that there's no job description for a police officer. Like, we never learned in our training how to police a pandemic situation. But because this pandemic came out of nowhere, so we improvised ourselves and we made ourselves and our staff capable of dealing with the pandemic. At the same time, keeping ourselves safe from pandemic, and at the same time delivering utmost services to the people of Pakistan. After managing this crisis that we are still managing, but of course the second wave of COVID-19 in Pakistan is not that severe as the first wave of COVID-19 was. Many people, many police officers, senior officers, street cop, they contacted COVID-19. That, as I told you earlier, that all over Pakistan, 24 officers from Sindh Police, they died of COVID-19, and around 900 officers all they gave their life. We have also given this suggestion to the training branch of Pakistani police that policing a pandemic should be included as a module, and it must be made an important subject during the training of police officers. Because our generation never experienced any kind of pandemic, not in this region of South Asia, because the last pandemic, as we were told, was back in 1945 in Pakistan, and that too was disease that's no more there. I can't recall the name of that disease. So this policing a pandemic is a new topic, is a new subject, and this should be made part of training of police officers. Apart from this, we also noticed that healthcare system that is already in place, it cannot work its way out without the help of law enforcement agencies. And a new coordination was developed during this COVID-19 time between the health professionals and police department. This was not before. So it also gave us an idea that there should be a strong coordination between these two departments.
I've seen that woman. I don't know what is happening here.
Please, could you unmute yourself?
Please,
because the speaker is still speaking. Please unmute yourself. Sorry, Superintendent Aziz, please carry on. Thank you.
These are the few lessons that we learned while policing the pandemic. So that's it from my side, and the platform is open for questions and answers if any.
Thank you very much, Superintendent Aziz. That was a really list of areas that police became involved in. And I think for me, what's very surprising is to hear things like hoarding, things like cash transfer, the whole issue of domestic violence, and a very specific burden on the lady police officers is really interesting. Also, what's of note to me is a very clear recognition within the police force itself that there was no training, that people were not, it was not part of their bandwidth to think about how they would police during a pandemic. And so this very open and honest recognition for the need for training, what that module might look like in the future is something perhaps we could discuss. And very specifically and clearly, the whole issue of coordination with public health agencies. So I think you've raised some great ideas that we could follow up on, and also flagged some very surprising areas that we don't normally associate with policing. Thank you for that. Please stay with us. We are going to now move on to our next speaker from Bangladesh. And we are very lucky to have with us Superintendent Shahela Parveen. Superintendent Shahela Parveen is currently an Assistant Inspector General in the police headquarters in Dhaka in Bangladesh. And she joined the police force through a very competitive civil service exam in 2003. And her training is in political science from the University of Dhaka. She's been with the police for more than 18 years. And she has been the recipient of the Bangladesh Police Women Leadership Award in 2017 and the Inspector General Police's Exemplary Good Service Badge in 2018 for her in policing, human resource management, networking, and the empowerment of women in the Bangladesh Police Service. She is responsible for conducting a lot of training for police officers. So when we've been talking about the issue of training and capacity building, we want to hear a little bit more from Superintendent Shahela Parveen, what her thoughts are on the issues that Superintendent Aziz raised earlier about training. She also provides a lot of training on topics such as diversity and gender. So overall, I think a very strong and clear focus and capacity on women's rights, investigation of women's oppression cases, terrorism, as well as combating human trafficking. So let's hear from Superintendent Parveen what your experience has been over this pandemic. Bangladesh was pretty hard hit. Tell us a little bit about what really worked, what were the lessons you learned, what were some of the key challenges, and what do you see as follow-on areas for work moving forward? Superintendent Shahela.
Thank you, respected moderator, Ms. Mukhtar Sharma, for introducing me. I would like to express my special gratitude to the organizer for selecting me as a speaker in this wonderful program. Respected chair, moderator, learned speakers, dear participants, good evening from Bangladesh. You know, COVID-19 is an unprecedented challenge the world has ever faced in the recent past, and it is a formidable human crisis. At the moment, the utmost priority is to save lives. In view of this mounting crisis, countries have no choice but to adopt immediate and effective measures to curb this pandemic. And you know, Bangladesh World Health Organization declared the COVID-19 pandemic on 11 March 2020. And in Bangladesh, first COVID-19 case was detected on 8 March 2020. And Bangladesh government declared lockdown all over the country for ensuring save lives for the citizens on 26 March. And what is the role? In that time, Bangladesh police has played an extraordinary role in prevention of spreading and controlling the contagious disease of COVID-19 pandemic. And it has done by Bangladesh police ensure lockdown, quarantine, strict application of hygiene, isolation, wearing masks, and social distancing. You know, the contributions of Bangladesh police go back a long way. The members of the audience might have some thoughts why this global crisis would seem a new experience for the institution of public order and rule of law. The statement, of course, involves the collection of supreme sacrifice by Bangladesh police during the Liberation War in 1971. The first bullet was shot in the Liberation War by the member of Bangladesh police. And this pandemic is like a second war of Bangladesh police, and we have taken the issue with the utmost dedication and give the services to the citizens relentlessly. And now I want to share with you what are the challenges we are facing, still now we are facing. And now I want to share with you, we are really facing the different types of challenges amid the COVID-19, and like the internal challenges and external challenges. First, I want to explain the internal challenges. That means the first challenges I want to say. As a frontline responders, the prime challenge of the members of Bangladesh Police is to stay physically fit while combating the pandemic alongside maintaining the law and order. And Bangladesh Police, Bangladesh Police have near about 0.2 million members, and our police force stay in barrack, where they take their food in dining together, share washrooms, they move together to maintain the law and order in the same vehicle. So in that case, social distancing is very much difficult for them, and that was our first challenge within the police. So the chance of COVID-19 transmission was high in that time from the beginning. But our respected Inspector General of Police, Dr. Benazir Ahmed, BPM Bar, he is a very dynamic leader. Under his leadership role, with the cooperation and coordination of Bangladesh government, he arranged separate barrack for the forces, rented hotels for the police members. He also made sure the memorandum of understanding, that means MOU, in the private hospitals along with the Bangladesh police hospitals for ensuring the treatment of the police family. And taking these initiatives, the transmission of COVID-19 within the police reduced sharply. So I want to say we have to face the challenges within the police, but the leadership of our Inspector General of Police, it reduced within the short time. And secondly, I want to share with you our second challenges, or I want to say the external challenges. What are the challenges we face? Just I want to say we have faced a lot of challenges like the lockdown, ensuring lockdown, quarantine, strict application of hygiene, ensuring the social distancing from the citizens of Bangladesh. And that this is on Bangladesh Police adopt standard operating system, that means SOP, to combat COVID-19 pandemic 2020. And following the SOP, we, Bangladesh Police, are working awareness raising tactics by using 4E methods. The 4E, that means number one, the engage, number two, the explain, number three, encourage, and number four, enforce. First step we can follow, we engage the public to raise awareness about COVID-19, talk with them, listen to them, make them understand, and attach importance to their opinion. And secondly, we provide information to people regarding the spread and prevention of COVID-19, make people responsible so that they avoid risks and maintain the social and physical distancing. And number 3E, we encourage people to stay at home and spend time with their family, appreciate them for assisting and cooperating Bangladesh Police. And number 4, we enforce laws when required with courtesy and professionalism. So in this 4 process, we follow the SOP of Bangladesh to combat the COVID-19 pandemic 2020. And really it was very much fruitful to implement. And Bangladesh Police play a significant role to keep the economic activities normal by enforcing the health protocol. Now, I want to share with you, in Bangladesh, around 6,500 police have been infected by this disease on duty, which represents 3.5% of the total COVID-19 infected patients of Bangladesh. I want to share with you until 13 February 2021. And we lost 79 police officers. They bravely sacrificed their life on duty. Among 8,298 deaths in pandemic in our country still today. I want to say about the role of the government. Share with you, the Bangladesh government is, our Honorable Prime Minister's women, Sheikh Hasina, she is a lady, so she's empowering us, and also she's very much positive, very much dedicated for our country. And Bangladesh government had started vaccination of COVID-19 on 27 January 2021. And our Honorable Prime Minister inaugurated that program. And it started first vaccination to the frontline fighter, like the healthcare providers. And vaccination opened for all on 7 February, where every citizens can take this vaccine. But Bangladesh government first priority the frontline fighter, then the government officials and the senior citizens at the age of 55 get the vaccine first priority basis. And still today, near about 1.36 million people administer the first dose of the vaccine. And also Bangladesh government has a plan to administer second dose of COVID-19 vaccine from 25th March, and it will execute 8 weeks after the first dose. Right now, what we have learned. Just I want to say I have learned when any emergency arises, we need to work in an integrated way to combat any sorts of battle like pandemic COVID-19. And we have also learned how to show empathy with the colleagues, sympathy with the citizens, and collaboration and coordination with other government and non-government organizations. And I have a lot of experience how the members of Bangladesh Police dedicated their lives when they knew their lives in danger. When the pandemic panic was high, citizens were staying at home. We work with perseverance, dedication for our country, and our utmost professionalism. And I want to say it was the time when the child leaves her mother in panic for survive from this virus. Son didn't take part in the funeral activities. In that moment, Bangladesh Police besides them with the empathy and humanity. And at last, I want to say, Bangladesh Police has achieved huge national-wide accumulation and trust from public because of our utmost dedication and gallant services toward the people of my country. Thank you for passion sharing. Thank you all.
Thank you very much, Superintendent Shahila Parveen. Again, some really, really interesting things for me that I wasn't expecting. But what I really liked was your 4 E's: engage, explain, encourage, and enforce. I was also struck by the fact that you said courtesy, that the police felt that their role was to be courteous even during enforcement, and the clear rule of providing support to the police from your government in terms of engagement of private providers, as well as people having hotels, the police force having access to hotels. So while you saw a lot of people being infected and affected within the police force, there was also a very clear strategy from the leadership. And I think Superintendent Suhai also talked about this, that the senior leadership did really demonstrate care for the police. Did I understand from you correctly that there is also vaccination for police officers as part of frontline workers? Okay, I just want to confirm that. So thank you very much. I take away from you some key messages. The need for SOPs is something you highlighted. You also talked about the need for working in an integrated way. And this is something that we will discuss a little bit more later. How might we integrate? So let's talk to our next speaker, who is from Nepal. And we have with us Superintendent of Police Dinesh Kumar Acharya. So Superintendent Acharya has been with the police force in Nepal for over 22 years. He's a very senior, and he's been involved in 3 UN peacekeeping missions. His latest role is that he's in charge of the COVID-19 Central Health Desk of the Nepal Police. This desk was established after the pandemic hit, and the idea was to coordinate with all of the different agencies to deal with the epidemic. So it formulates policies and strategies for police mobilization. It updates the records of infection in police personnel. It manages it manages isolation, the isolation processes and SOPs, hospitalization and transportation of infected police personnel, issues orders and directives on behalf of the police headquarters on all issues related to the COVID-19 pandemic. So we are very lucky to hear from you, Superintendent Acharya, because your role is slightly different in terms of coordinating from within the police your response to the COVID pandemic and how that interfaces with health. So we'd love to hear from you about your experience. And as with the previous speakers, I'm requesting an idea of what has been the good practice, what has worked, what have been your challenges, and what do you see are key areas of follow-up in the future? So over to you, Superintendent Acharya.
Thank you, Mukhtar. Good afternoon, everyone. Thank you for giving us this platform to share our experiences, what we have been through during this period. As all of us, the pandemic has a great impact in our lives, and we are also the part of this pandemic. So we definitely have a greater role, because it's a saying that if there is no one to do the job, there is a police always to do the job. So we are always there to fulfill this gap. Here, in the context of our country, the first COVID case was detected on the 23rd of January, and then the second was detected on 23rd of March. Right after detecting the second COVID case, our country enforced a complete lockdown. So, in the meantime, while seeing this priority that we have to deal with these things, our police headquarters established on 20th of March a central COVID health desk, which is looking after all of these issues, what policies, planning, and all those things, that how to deal with this if this spread a lot throughout the country. So basically what we did is there are the two things, the major things that we had to deal with. One, within the organizations, how the police keep on functional. So I'll share. Sure, to keep the police units functional and operational within minimum number of COVID impact, that how we can do that. The first, within organizations, it is our responsibility. And second, outside the organization, as a whole, is to be the widespread outbreak of coronavirus in the country. So these two sectors, we divided the whole of the issue on these two sectors. So within our organization, what we did is we established a central COVID health desk, whose role and responsibility is to coordinate and give guidance to all of those, so that we can centrally monitor what's going on in our organization and outside the organization also. So COVID health desk was established, and this desk prepare an action plan for coronavirus prevention and control. So we prepare action plans, like for within the organization, how we can keep our personnel safe. So maybe we designed like maybe shift system, maybe work with reduced strength, or maybe working with alternating working arrangements, and to keep the office clean, maybe sanitization, maybe all those things that we make an action plan and send it to the distributed to all of our units, which is working in the field. And then we also did health and safety protocols for police personnel, so that maybe the people who are seeking police assistance or all those things, those people coming inside our police stations, maybe we'll check their health condition and then let them, or maybe in a distance, maybe we work outside working station, all those things that we set up safety protocols, and even guidelines for arrest and detention for investigations, because we cannot keep a lot of people inside our custody, so that these places became the center for COVID spread. So what we do is maybe we set up a standard like those people with minor crimes, offenses, maybe will not get detention, maybe we'll set free with some kind of legal arrangements. Maybe some cases we shifted it later to see. I mean, these kinds of arrangements we made to keep our office operational. And then also we have these safety materials needed for the police personnel to work in the field. So we manage all those safety materials like masks, sanitizers, and protective equipment, all what's needed during this period. We manage and send it to the working force on the field. And if those people who come into contact, or if they have any kind of symptoms, so we made tests for the police personnel. And then we set up a quarantine and isolation center for police personnel, because most of the police, those are working in the field, are staying in a dorm or barrack system, so that if one get infected, then the other may transmit it to the other. So that we need a separate isolation or quarantine places for the police personnel. So we set up this quarantine and isolation center to segregate them from these places. And also, if any of them get infected, though, we make arrangements for their transportation so that they can work, with high moral conditions. And then we updated all those records so that we can, in the future, then we can do all those things. So here is those simple pictures where I can see that those people entering inside the police premises. So we check their temperature and all those things so that they are not getting infected and all those things. These are the protective equipments that we supply for the police personnel so that they can carry out their duties, checking and all those things smoothly. So this is the part of which we did to protect our police personnel. And then the other part is for all of this country. That, as I said earlier, that our country went into lockdown on the 24th of March. Then our prime duty was to enforce the lockdown. So our country is surrounded by just two countries. So since all those air transportation was blocked, so we didn't have much problem. And there is China in one side, so there is not much problem with that country. But almost 1,200 kilometers around the border in India is open, so everyone can pass easily from those places. So that is a great challenge for us. So there are two, either one seal the border, bordering India, and another one is enforcing within the country the movement and the unnecessary movement of these people. So that is a really difficult task during that period. And then, of course, and then movement of emergency services, because we keep those emergency services available at all the time. So we have to manage those things also at the same time enforcing the lockdown, and then maintaining the supply chain, because there are no vehicular movements, but at the same time people are scarce of foods, medicines, and all those essential goods during that period. So we have to manage all those, the supply chain also. And then we have to look after the stockpiling or cartel, because during that period, there are still some people who is looking for profit and all those things. So these are the challenges that we face at the time. And definitely black marketing, smuggling of medical supplies related to COVID, face sales, all those mask sanitizer, face sales, and thermometer, PPE, these things were smuggler and then black marketing. So we have to look after those things also. So also at the time, maintaining isolation and holding center, because we have a large number of people working in India, and then since at the both sides, those places were closed, but the people, all of those are traveling, walking, or all those things. And during that period, almost 650,000, something like that, Nepalese are entering from India to Nepal. So at the very first time, what we do is those people coming from India are all near the bordering area for quarantine and all those things. So that was really a big challenge. And then also contact tracings, that is also done by the police. And after the record of hospitals, ICUs, ventilators, infected and cured patients. So we take all those records so that we can manage the people during that period if we get a lot of people, so that we cannot make specific arrangements for these people. So also, during that period, there are a lot of vulnerable people which we have to take care because there are people who are without food or medicine and all those things. So there's nobody else during the lockdown period in the ground except the police. So we have to take care of all those things so that we maintain all those things also. And then also public awareness and sensitization to deal with this COVID. Here are some of the pictures that we did. We did supply food and all those medicines. And we take record of all those people who are vulnerable to that period so that we can manage all those things. Now, the real thing, what we have seen during that period is proper about this COVID-19, the proper information or sensitization of public was not done properly, so we faced a lot of problems during that period. Actually, maybe this COVID-19 was a little bit overrated or exaggerated at the very beginning because we didn't see any local transmission after the second case was detected in our country. So, but we immediately enforced this lockdown that people feel that, okay, it's a very dangerous thing and anybody who is infected by COVID is looked at as a criminal. So what people are doing at that period is the thing that they are self-doing this kind of crisis, or maybe let's say that this is a crisis in social harmony. People are blocking the road. People are, if they found any people in their neighborhood with COVID, then they will just go to their house and they will lock it from outside. They will not let anybody inside their territory. And then what happened is that there is a clear division within the society. So maybe it is ill-informed or maybe overrated, so that maybe people are reacting in that way. And then also, we didn't have any successive planning because at the very beginning, what we did is we just enforced the lockdown. But there are people, a lot of people are stranded. They were not able to go to their places. And then later on, what we observed that people are walking maybe for a week or 10 days to get back to their home. Or even the people that are going back to their home are not welcomed by their societies during that period. They are suspected that these people might have carried COVID or something like that. So they will not allow them. So this kind of problem was faced in the societies. And then of course, these temporary shelters are quarantine places that we have established near the border or other places. So since we didn't see that the number of people, what number of people are coming from other places. Now, when the people are coming more than our capacity, what happened is that the shelter or the quarantine places that we have established itself became a center for COVID spread. So these are the challenges that we faced during that period. And there was some issues that was raised during the questions, that is there what national level, at what kind of responses our government has issued. Definitely before the lockdown started, the government has established a national COVID-19 crisis management center with a high level of chaired by the Deputy Prime Minister. And definitely there was another National Emergency Operations Center in the Home Ministry. And then in the district level, we have each of the district, we have district crisis management center, which manage all of those COVID cases during that period. Definitely we are not able to do all those properly, but anyway, at the moment, we are in the vaccination process. Most of the government employees are getting vaccinated during this period, including the police. And then maybe after 7th March, we are vaccinating all those people with age more than 60 years. So these are the things that I need to share with all of you from our side. Thank you very much.
Thank you very much, Superintendent Acharya. And it was great to see some of the pictures as part of your PowerPoints that gave us a really visual impression of what it was like in terms of the police delivering on their role in Nepal. I was impressed to see that they actually had some very good equipment and PPE. And I think that shows the good planning that you were able to do as part of your role in terms of coordinating the fact that the force could function and to prevent infections within the force, and to have very clear SOPs around how the police could continue to be protected and continue to deliver on its public role. I was also struck by 3 things that you mentioned. The first, the police was directly doing the contract tracing. I think that's unusual. And the fact that the police had such a clear role in contract tracing is something which perhaps we can discuss more later. I was also struck by the fact that the police had such a big role in data collection in terms of the public health statistics of the numbers who were infected, which hospitals, which ventilator, which ICU. And in that sense, your coordination role had quite a big chunk of strategic information collection and using that strategic information. The third thing you said, which struck me, was the issues of stigma and discrimination. I think this has been such a big problem with COVID everywhere, but you have highlighted the very specific issues that were faced in Nepal in terms of stigma and discrimination when somebody was infected by COVID, and what the role of the police was in addressing that stigma. You also talked about the particular protection of the vulnerable, including food supply. So these are all really, really interesting things for us to reflect on. What we might do now is move to the next part of the webinar, where we will have a panel, and you are the panel. The panel is made up of Superintendent Acharya, Superintendent Shahela Parveen, as well as Superintendent Aziz. And we are very lucky with us to have the discussant. Our discussant today is Professor Carl Roberts, who is a WHO consultant on policing and pandemics. He divides his time between the United Kingdom as well as Australia. He's based at the University of Western Sydney. But Carl is a behavioral scientist, and he specializes in seeing how evidence-based insights from behavioral science can be used to inform a professional practice and policy development. So very, very happy to have Carl with us. And so what we're going to start now is go to the panel, where Carl and I are going to support questions, put forward the questions that are being asked We've had a long list of questions which has come through from the participants. They're very interested in this. So perhaps what I'll do is, Carl, I'll turn it over to you to ask the first couple of questions, and then we can take it over from there. So if you want to kick off, and then I'll jump in when you want me to jump in. Over to you, Carl.
Okay. So thanks so much, Mukhtar. Thanks for your kind introduction. Hello, everybody. First off, thanks so much to our presenters. Absolutely fascinating and really, really interesting insights to see, and pretty much I'd echo everything that Mukhtar said about some of the important points that come out from there. As she said, we've got a large number of questions coming through. What I've been trying to do is to sort of try and group them together, because obviously people are interested in similar aspects, really. So the first question that's really been of great interest to a number of our participants is really about the experience the different police organisations had with working with agencies like public health before COVID-19. So this has come from a number of participants, various versions of this particular type of question. So if I start really with Superintendent Akaria. I'm going in the order across my screen, so I'll start with Superintendent Akaria, then Superintendent Pervin, and then Superintendent Aziz as we move left to right on my screen. So no particular order, but well, I'll just put that to all of you. So just to reiterate the question, really, if you could just talk a little bit about what experience your various organisations had in working with agencies like public health and the kind of issues you'd worked with them on over time before we actually came to working with the pandemic.
At the beginning, let me say that definitely there were some time before the pandemic. We also worked together with other agencies also, like in the health sector also, because we had to deal a lot of issues with the public and health sector, so we coordinated during that period. But definitely after the pandemic, it became so wide. The range is so wide that we had to coordinate everything together with the health sector, because they are the leading agency during that period. But since their presence is not at every place because the police, the unit of police is spread all over the country than the other agencies. So definitely those agencies which are not present there, so we had to do their task also together with them. So we definitely coordinate a lot of things together with them to management of the isolation and then these health issues, medicine, a lot of things. So it is a great to work together with them, and we have a good cooperation, because in every district level or even in the central level, we have those agencies set up to deal with the COVID. Well, was represented by every sector of those health sector, police, military, and other civil organizations also together with them, so that we coordinate everything together to do the job.
Oh, thanks for that. I mean, so again, it seems like you had some kind of relationships that you developed before the pandemic that you were able to leverage as the pandemic evolved and developed. We will move on to Superintendent Pervin, please, and just again for your reflections and experience.
I'm not sure she heard you, Carl.
Okay, so Superintendent Pervin, again, just from your experience in Bangladesh, please, about partnerships that you had prior to the pandemic with public health.
Thank you very much. really before the pandemic, with the collaboration with the public health in our divisional level, district level, and Thana level, we have the coordination and cooperation with the public health organization. But I believe that after the pandemic and during the pandemic, it is strengthened our relations with the trust and confidence with the other organizations like the health services, as well as the other organization in the divisional level, in the district level, and in the Thana level. Thank you.
Again, same question to Superintendent Aziz, again about public health cooperation prior to the pandemic.
Thank you, Mr. Khan. There was this coordination between public health institutions and the police prior to COVID-19, and that coordination was a major reason for that coordination was our monthly polio vaccination drives and our monthly immunization drives. And during those drives, the teams of polio workers had to go to the far-flung areas and they needed protection of police. So police had always been with the healthcare institutions, but because of this COVID-19, the coordination became more strong, loud, and visible. And after the COVID-19, the scenario has enabled healthcare professionals and law enforcement personnel to know each other's job in a better way.
Thanks, everyone. I think that, it's an interesting point that, it seems that all the various agencies had some kind of relationship for various reasons with public health. And that seems to have been an important aspect that you could leverage as you move forward into dealing with the pandemic, to some extent making life a little bit easier with those existing relationships. And that's certainly something that's come across from other nations as we've talked about these exact same issues, that where nations had existing relationships with public health at whatever level, it always made it somewhat easier to sort of build forward as they tried to kind of invent what they were going to do to COVID-19 and the different challenges that presented. Moving forward, one question that, again, I'm kind of summarizing a number of questions here in my own words, so apologies if for the questioners if I've not totally hit what you meant by it. But I'd just like to ask about the experience of the police in the various nations of working with what we might call hard to reach communities. So perhaps communities that are more stigmatized than others. So individuals who, someone raised a question of working with perhaps drug workers, drug users, sex workers, those infected perhaps with HIV, who are often marginalized communities. To what extent, what challenges, if any, and how have you dealt with those kind of communities during the pandemic? And again, I'll take that in exactly the same order. So Superintendent Dinesh, if you could comment from your perspective.
Well, during this pandemic, we cannot go without this community because we have to meet, because all those things we are doing in favor are all of them are working together to get rid of the COVID. So definitely we are together. In some instances, because as I mentioned earlier, that in some neighborhood, what we found that even if a doctor is found with infection, then the people goes around at the very beginning to say that, okay, this person is infected. So they'll put a banner on those people's house, or maybe they'll just put a padlock out in the gate so that he cannot really move in. So during this period, what we need is sensitization is basically necessary, and then we have to convince the public. We have to work together with the community so that, okay, look, these are the people working for you, so you have to convince your community so that they will not do anything else which will disturb the social harmony within our people. So during that period also, and not only that, because we work together with the community so that there will not be any disturbances to move those necessary things like daily goods and all those pandemic related issues, or that maybe they will work together with us to derail this cartelling things, or maybe stockpiling all those things together, so that we work together with the community, because these are the basic where we get the information. So when the people are working together with us, it will be easier for us to handle those situations. Because in some places, like if you are enforcing a lockdown, then it is the community needed to understand that, okay, because it is for us, so we have to obey all those rules and regulations that is set up by the government. So we have to convince them. So if we are able to do it together with the community, so rather than enforcing, they are self-respecting those rules and regulations, so that we can control this easily. So
I think you froze ever so slightly at the end there. You just want to say your last comment, Superintendent, just the last couple of things that you said there. I think you froze in mid-sentence. So you just finish off as you were finishing, if you don't mind.
Well, normally, because we work together with the community, so that it is easier for us to handle those situations, because since the COVID is a common problem, it's not only of the government or of the public. So when the public and police or the government work together, or the agencies that are responsible to deal with this COVID are working together, that it will be easier for us to deal with those and to control those things. So rather than enforcing this lockdown and all those safety measures that are the standard that government has set. So if these people are automatically accepting those rules and regulations, so it will be easier for us to deal with it. And then definitely to some extent later on, at the beginning, it was very difficult to make them understand, but later on, when people are convinced, then it will be easier for us. It became easier for us to deal with those, or to deal with the pandemic.
Excellent. Thanks so much for that. Again, the same question to Superintendent Pervin, again, about dealing with, if you like, the hard to reach, more stigmatized communities, and if with strategies and your experience of working in that space.
Thank you. Can you hear me?
Yeah, we can. Yeah. Yeah, we've got you back.
Thank you. It's a really the same experience because in the South Asian countries, the sex workers and third gender, which is called HISDA in my country, and the same behavior and attitude in the Southeast Asian countries. And our Honorable Prime Minister declared the HISDA, we call the HISDA in my country, declared the third gender. So they are very much the sex worker, the drug user, the the third gender. They are the very vulnerable group in our country. And we really treated them as well as the other people, not only amid COVID-19, but also previously we Bangladesh police, we treated them with the great humanity, and with the mainstreaming, we try to convince the public to remove the social stigma. And also, I know the Bangladesh, some police officers give them the food supply for their survival amid the COVID-19. Just I want to mention some high officials and also officers give the food when they lost their job, and in that time they really severely they are passing the time from the lockdown, especially the first 3 months, March to June. But when after the July, the government opened the lockdown because in this vulnerable group, it was very much tough for them to survive. So after the 3 months, they can survive by their own activities. That's all from my part. Thank you.
Keep forgetting to turn on my microphone as I speak. Thank you. And Superintendent Aziz, the same again, the same to yourself about dealing with these stigmatized communities.
Marginalized communities in Pakistan were hit hard by COVID-19. The effect was not only the health hazards, but the financial impact was really big, and it was really difficult to make them understand, to counsel them. But one thing we realized, that among all the stakeholders or the government officials, police had more power to negotiate. Police were considered relatively more eloquent counselors than others who tried to counsel them. And the goods, the cash, and the food that was provided for the marginalized community was also distributed with the help of police. So, police was in a better partnership with the marginalized communities in the post COVID-19 period in Pakistan.
And that's fascinating. I think again how often with these communities who many in society don't really want to work with or talk to, that a lot of the care for these people has fallen on the behalf of police, and police have sort of risen to that. And I think you've all mentioned that point of police often supplying food and being responsible for counselling, support, and helping people out, which again, I think going back to one of the early presentations is not really something police are often trained to do in a sense. It's often not a job that police would expect to be doing. And yet it's almost developed as this has been an area of support, which is interesting. And again, I think moves on to a point that was raised about training, about whether or not police get sufficient training for pandemics and what they do need to know, which perhaps we'll look at later. Another question that a number of people have raised, or variations of, is about decisions to enforce and the situation. What were the considerations when a decision was made, perhaps to arrest somebody for breaches of quarantine or breaches of lockdown regulations? In a sense, what do people have to do to get arrested, I guess, is the question. How much tolerance were the different police forces allowing for people? I know we've talked about engage and explain and trying to work with people to explain to them the situation, but at what point would officers in the different forces actually arrest people? If you could comment on that. And again, in the same order, can't see Superintendent Dinesh. I think he may have disappeared at the minute, so he's not on my screen. So I'm going to start with Superintendent Pervin, if you don't mind. We'll start with you, and then we'll look at Superintendent Aziz, and then apologies, I've got Superintendent Dinesh's back. Thank you. I'll go to you, Superintendent Dinesh, first, and then we'll move along as we have been doing.
So definitely we did not even. During this pandemic, what we did is we even did not arrest the people with the petty crimes. So definitely during that period, we did not make any arrest. But definitely during that period, those people who are not compiling with those standing orders to follow the rules that set up during that period, like people those who are not working using masks in public, almost more than 500,000, or 655,000 people were punished, or maybe less than that, they are imposed some fine to pay during that period, who was not doing those things. But definitely we did not arrest them, but during that period, maybe we hold those people who are not following the lockdown protocols, not doing the safety protocols and all those things, or maybe those safety standards to do those. Definitely we didn't make any arrest during that period, but we make them pay some fine and all those things. Thank you.
Thanks for that, Superintendent. move over to Superintendent Pervin, please, if you don't mind.
Sure. Really, we know the police has the authority to arrest the offenders who violate the public health protocols. But in this content, amid the pandemic, Bangladesh police didn't take harsh decision. Rather try to motivate and award them, and we follow the SOP which was made by our Inspector General Police. We followed these 4 methods, especially not the last one, not enforce. We try to engage the people, explain the causes of this pandemic and how can spread this, and encourage them. Third one, they'll encourage them to maintaining social distancing, quarantine, and wearing masks, blah, 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 we know. So really we follow this SOP, but not last on. Especially in that pandemic time, the people are very much sensitized, very much aware, and not only that, but also they are very much panic the COVID-19, and in this situation, police didn't take the harsh decision to arrest the people, or rather to cooperate them, to award them, to inspire them to maintaining this health protocol. Thank you.
Okay, thank you so much. And Superintendent, as it's the same question to you from the Pakistan experience.
It's a very interesting question indeed. I would like to tell you that the basic policing unit in Pakistan is a police station. And any person who is in contradiction with the law, or any person who is arrested, is kept in a police lockup in a police station. So during the COVID-19, it was a challenge also that we have to maintain a specific number of people to be present in a police lockup, and we could not make a police lockup overburdened or overpopulated. This was one of the reasons, and the arrest for this reason was also discouraged. And when it comes to the people who are not following the SOPs of COVID-19, definitely, as said by the officers from Bangladesh and the officer from Nepal, we engage them and we counsel them. During this period of COVID-19, from March to June, there were torrential rains in Pakistan as well. So during the torrential rains and the COVID-19, the situation was really tough for the people and for police as well. So what we did, we used our police patrolling mobiles along with the speakers, and they were in the roads. They were sent to the far-flung areas, telling people to maintain the SOP, telling people what was the SOP, and also getting to know about their problems and communicating same to the concerned departments. Because police has outreach to the far-flung areas and reach to the people, and of course we have many ways to get the information from the community. Apart from this, awareness campaigns through television, through radio were also established along with the coordination of healthcare department. So these were the few steps taken by Pakistani police along with healthcare institutions of Pakistan to let people know about the SOPs, and that's how we tried to implement the SOPs.
Thanks for that, everyone. Yeah, I think it's a really interesting question. At what point do you have to enforce? And it's really good that, listening to everyone talk about the importance of working with community groups, of engagement, of explaining, and almost the very last resort is some kind of sanction, an arrest or fines, etc. And the sort of importance of maintaining public trust and the kind of ongoing need to do that being pretty central to all the strategies you have described to us. I think it certainly is. We've looked across the world in different areas. Obviously, there's other police forces who've gone very much for an enforcement first approach, which really, it's hard to move from that position. If you just arrest straight away, there isn't an opportunity to engage or explain or find out why somebody's struggling to meet with the regulations. And I think, as you've described, I think there is some wins from treating the public in that way in terms of the partnership and in terms of maintaining the future. What I'm going to do is going to hand over to Mukhtar just now, in case there's any questions that I've missed that as we've gone, in case she's picked any up. And I know we're sort of coming toward the end anyway, but so I'm going to summarise some of the things in a minute. But I'll just hand over to Mukhtar just if she's got any questions, just to raise it toward the.
Thank you. So one question that came up quite a lot is about police training and how there wasn't enough training at the moment to deal with this. The other question that's coming up quite a lot is police safety. How could we ensure better police safety for everybody who was on the ground working? So could I give each one of you 2 minutes to say, for police training, what's your #1 recommendation? And for police safety, what's your #1 recommendation? Going forward, what should be happening to improve police training? One top priority, to improve safety of the person, the policeman on the ground, the policewoman on the ground, to improve safety in terms of dealing with pandemics. So I'm going to go first with Superintendent Aziz. What your thoughts are on that very, very quickly. Then we'll go to Superintendent Parveen after that, and then to Superintendent Acharya. So over to you, Superintendent Aziz.
Thank you, Ms. Mukhtar. Actually, training of the officers and their safety are interconnected topics, because during their training, they'll come to know about the safety measures they can take during the pandemic situation. Actually, we have police rules 1934 in Pakistan that explain the rules for police officers. There is mention of the pandemic, but pandemic of centuries old pandemic and pandemic of the new era are quite different, and there are different demand of that era and different demand of this era. So during in training manuals, it's very necessary that different kind of pandemics with the experience of different communities, with the experience of different police organizations must be told to the trainees, so that they may be fully equipped of dealing with the pandemic situation. Apart from this, a very important thing is dealing and the coordination with other departments. Like Pakistan has a national disaster management department, and I hope every country has a disaster management department. So during these situations, the disaster management department and police department, along with health institutions, all become very useful. So the coordination techniques must also be taught to the trainees in the training institutions. And when it comes to the safety, it's very necessary, first of all, that the police officer must be fully equipped to safeguard himself from any disease. Of course, from COVID-19 is one of the deadly diseases the world is facing right now. So they must be given the equipment for it. And number two, police officers must be sensitized to know the hazards, health hazards of COVID-19. And during
Thank you very much. Thank you. The same question to you, Superintendent Shahela Parveen. Your thoughts on top priorities for improving police training and police safety?
Thank you very much, Sharma. In Bangladesh, I want to share with you when the pandemic was in panic situation. I want to say that first 3 months there is no training held in Bangladesh, but from June, the Bangladesh police maintained the social distancing and just in a new dynamics. The training started in a new dynamics where we didn't see in a lifetime in that system in training sessions. So I just suggest, it is my recommendation that we have to rearrange our module, our training manual. How can we participate and take part in the program in a new and dynamic fashions and new dynamics. That's my recommendations. And secondly, the safety, I want to say in one single word, safety is the first for the police personnel. Safety, we have to ensure the safety first. Then we have to services to the citizens of Bangladesh. That's all about me. Thank you.
Thank you very much, Superintendent Shahela Parveen. Now, the same question to you, Superintendent Acharya. Any thoughts on the issues of training? You've been doing a lot of that work already in terms of training and SOPs. And we saw that Nepal police seems to be very well equipped in terms of safety. But do you have additional thoughts on this issue?
Definitely, because prior to this, we make some kind of a basic training on preliminary type of treatment. But specifically those pandemics which are spreading nowadays, maybe there are different types, others also. We did not even till date included all those things in our training manual, but definitely we are working out on how to deal with these kind of things during the pandemic. We include those things of these experiences in our training manual, that how the first priority is.
I think you're muted, Superintendent Acharya. Please go ahead.
Okay, so we are thinking of including all those things that because the safety priority of those, if you are not safe, you cannot make the community safe. So the first priority is to be safe yourself. So that we are including all those things during the particular, what are the minimum standard that a police officer, a police personnel has to meet to deal with this kind of pandemic. So definitely it is a rising issue, and then we have to incorporate this in our police training also. But in the part of the field that we have right now issued order and all those things to make the office safe, to make our staff safe, to make minimum standard so that our units are functional and operational. Thank you.
Thank you very much. Thank you for those very clear and quick answers. I'm going to turn it over now to Carl for summarizing and wrapping up. So Carl, over to you.
Thanks, Mukhtar. And again, just to reiterate, thanks so much to everyone for taking part. I know you're all probably insanely busy right now, especially. So for giving us the time, it's been fantastic. And certainly it's been fascinating to hear your experiences and your ideas and recommendations moving forward, which I think really do sort of inform what we know about pandemic policing. What I want to say is just a few words to really conclude and sort of try and suggest ways we might move forward on this. I've been working on a project with the WHO, really looking at the way police and public health agencies work together in dealing with really biosecurity issues, of which pandemics are an example. And we've been looking very much at the challenges that exist for both police and for public health in working in this field, and particularly how these agencies may well work effectively together. And I think some of the learning from the COVID-19 experience is really illustrative of the challenges that police especially face and the changing expectations that are placed upon police. I think it was you, Superintendent Acharya, who said that, you know, the phrase that if there's nobody to do a job, then the police will do it is a really apt phrase here, that as we've looked across the world in different nations of how they've dealt with COVID-19, often it's been the police who've ended up doing the job that no one else could or would do. Often dealing with stigmatized communities, often trying to get the public to follow often hastily written rules by government, and often where police have been given very little time to actually think about how they could respond to the rules. The rules have just been handed over to you police to deal with it. And this has presented all kinds of challenges, which I think worldwide the police have really risen to. There's been lots of variations in international practice. And I think it's been really refreshing today to hear about approaches that are very focused on maintaining a relationship with the public, built on trust, built on engagement and explanation, rather than sort of going immediately for an enforcement approach, which in some ways is a simple approach. You know, police have guns, police have authority. Why not use that to keep people off the streets? And of course, that important realization that if you do that, it can often work in a counterproductive way, that the public don't want to follow the rules, don't want to engage, and also trust in police starts to fail. I think there's a number of notes I've made very, very quickly, and I'll just go through the headlines of them that come out of today's session. And really, it's really a sort of reflection on where we go from here. There are going to be pandemics in the future. We can't avoid them, and very likely there's going to be more frequent than we've seen. And this, coupled with climate change and all kinds of other issues that are contemporary challenges, all of which are going to affect police as that frontline group who are the people we turn to when there's nobody else to do the job. And some of the things that I've noted coming out of today, really, as we move forward, I think the issue we just discussed, training is fundamental. Police need training in how to deal with this new world, this new normal, the pandemics we might experience. Well, what's that training going to look like, and what should it contain? And I think some good reflections from all of our speakers on the sorts of things that should be in that kind of training. But certainly police can't avoid, I don't think, some kind of future training in dealing with the issues that comes around personal safety, dealing with the public under a pandemic, what even pandemics are like, and how they might impact police practice. I think there's a very large piece on officer safety and well-being, and I think each of our speakers mentioned this, about the challenges that forces face to maintain well-being of their officers, and how in doing that, it has significant impacts upon their operational effectiveness. When we have staff who are not available, deaths amongst staff, and the impact that has upon morale amongst their colleagues, and again, how we manage police, in a sense, increased workloads, and again, how that impacts upon staff well-being, on staff stress, absenteeism, and how all these things then impact, as I said, upon how effectively police can carry out their normal duties, let alone the ones that they've been asked to do under a pandemic. I think there's a big piece on the coordination between police and public health, and indeed other agencies, and how police work together with these different agencies. And I think as people mentioned as they talked about the importance of pre-existing relationships. It's very difficult to develop a new relationship with a new agent, with another agency, in the midst of a major crisis. But if those relationships are being built over time and they pre-exist, they make life a heck of a lot easier than having to rebuild them at the moment of challenge. I think there's some challenges about police leadership too. How do leaders in police galvanize their organizations to follow the rules, and for all staff to work together to maximize performance and output? I think that's an important piece in this mix. And I think there's another piece that sits across all of this, is about effective policing strategies. What strategies really do work with working with the public? A number of police forces internationally very much have used the kind of 4 E's, the engage, the explain, the working together with communities to build trust, build relationships. Because ultimately, when the pandemic's over, police are still there. They've still got the same public to work with. And so using draconian approaches or excessive enforcement runs the risk of damaging future relationships, which may impact on future policing. So of course, what are the most effective policing strategies, I think, is an important piece. And also in that space, what are not effective, what things make life a lot worse, and what things do negatively impact upon public support and public cooperation. But I think all of these are challenges that we face. And I think, the importance of bringing sessions like this together, hearing the voices of police officers and getting their experience is fundamental to this, because I think so often, as we've seen internationally, police are often not included at the table of discussion. They're just told to do things, told to do those jobs that no one else would do. And I think it's important to think about what the challenges and limitations are and advantages are for the police as we move forward, to really building up, for want of a better phrase, a good system of policing pandemics. So I'd like again to thank everybody. I'm going to hand over to Mukhtar anyway to sort of wrap up there finally. But thanks so much for your time, everyone. It's been fascinating. Thanks everybody else for listening and taking part with such great questions. Thank you.
So I have nothing else to say except a big thank you and salam alaikum and namaste to the speakers. And I'm going to hand over to Tim from Ines to do the closing remarks. Tim, over to you.
Thank you very much, everybody. What a fascinating conversation. All I'm going to do is thank everybody on behalf of the Global Law Enforcement and Public Health Association, to the speakers today, and to Carl and Mukhtar for the excellent facilitation, and to all of the participants for your time, your comments, and your questions. We'll be sharing information with you about the session recording in the next day or two. Just as a final point, I'd like to remind everybody that there is a related conference coming up, and that's the Law Enforcement and Public Health conference coming up next March, and there's a link here on the screen right now. Thank you very much indeed. Stay safe, everybody. Thank you. Bye-bye.